when this goes down, that means it's your cue to talk. He's going to roll the graphics for a minute. Lights are hot.
Hi everybody, I'm Megan, the Health Director for the town of Harwich, and I am recording a training manual for all town employees in response to COVID-19, mandatory safety standards and workplace training manual. The first part of this training manual talks about social distancing, and social distancing is important because this is a very infectious disease. And in order to prevent it from spreading to too many people, we need to social distance. Also called physical distancing, it's important to stay at least 6 feet from other people and not gather in groups. And stay out of crowded places. This is both in work and out of work. Right now, Governor Baker has us in a safer at home advisory. And that means that the virus is still active in the community, and we need to keep ourselves safe and those that we work with safe as well. Limit close contact with others outside your household, indoors and outdoor spaces. People can spread this virus when they don't even know that they're sick. That's what asymptomatic is called. When people don't have any symptoms and they get too close to others, they can spread the disease. And those people that are asymptomatic may not have any bad symptoms from it. However, they could take it home to a family member or loved one that's compromised and spread it to others that may not fare as well. When a person coughs or sneezes, that's when respiratory droplets are expelled from our breath, and that is how COVID-19 is spread, through respiratory droplets. When an infected person coughs or sneezes and you're within 6 feet of them, you can inhale those droplets. You can also get COVID-19 from touching objects that have respiratory droplets on them and then touching your face. However, it's not the main cause of spread for the virus. It's mostly person-to-person contact. Tips for social distancing in the workplace: stay in your designated work area. Try not to mingle between departments or floors. Stay in your designated spaces so you can maintain physical distance. Limit casual contact. Use email or call your coworkers instead of visiting them. The next part of this training is face coverings. Face coverings are mandatory in Massachusetts right now whenever you are within 6 feet of other people, inside or outside. Physical distancing is a way to not need to use your mask, both inside and outside. However, when you're inside, there are specific times when, even if you can social distance, you need to wear your mask. Included in this training is a decision guide on social distancing. If you're leaving home and you cannot maintain 6 feet of social distance to another person, you should bring your mask with you and wear it whenever you're within 6 feet of others. If you're outdoors and you can maintain social distance, a face mask or face covering is not required. When you are inside a grocery store, a pharmacy, a retail store, a shared vehicle, you must be wearing your face covering. Businesses such as the town of Harwich require face coverings when you're in common spaces like the bathroom, the hallways. Those are places that you may come in contact with others unexpectedly. So putting your face covering on when you're going down the stairs or entering and exiting the building is very necessary so we don't have unexpected contact between people when you're not wearing your mask. When you are in a vehicle or a shared space like an elevator, you should also have your face mask on. Face masks can be made of cloth, bandanas. They can be the disposable masks that the town has provided. It's important to put your mask on and off properly so you're not contaminating it or contaminating your hands. Your breath is on the inside of the mask and other people's breath can be on the outside of the mask. So it's important to use the ear loops and put your mask on and not touch the center of the mask. It's only effective if you wear it over your mouth and your nose. Your respiratory droplets come out of both. So you need to wear it over your mouth and your nose. And when you're taking your mask off, use the ear loops. If you're using a bandana, pull the bandana down from the bottom or the top, not touching the center part. And also, don't just toss your mask in your car or your purse. Always protect the inside of your mask. That's the part that you're going to be breathing in. So it's important to either put it in a special bag or a plastic bag and not contaminate the inside of your mask. Hygiene protocols. Hand washing is important year-round, every day, not needing COVID to be in the air or not. Hand washing can protect you from the flu, from GI bugs, from common cold, and especially from COVID-19. To wash your hands, you should wash with soap and water for 20 seconds, especially if you've been in a public place or you've blown your nose or you've coughed or you've sneezed. Avoid touching your eyes and your mouth if you haven't washed your hands recently. Key times to wash your hands: before, during, and after preparing food, before eating food, before or after you've treated a cut or a wound. Also, when you've been handling a pet or an animal, if an animal comes to visit at the office and you've pet the animal or used the pet treats, definitely wash your hands before you touch your face or eat or anything. There are specific steps to washing your hands, and I know we're all pros at it now. Wet your hands with clean running water, warm or cold if you can't get warm water, and apply your soap, lather up, make sure you get all surfaces of your hands, and scrub for 20 seconds. Rinse your hands under the running water, grab a paper towel, dry your hands off with it, use that paper towel to turn the faucet off. Throw the paper towel away, and if you need to grab a door handle to get out of the bathroom, grab another paper towel and use that paper towel to open the door to get back out. You don't want to contaminate your hands again after you've just washed them. Hand sanitizer stations have been placed throughout town buildings, and they are a good alternative when hand washing isn't possible. You can tell if the hand sanitizer is the right concentration by looking at a label. You want it to be at least 60% alcohol in order to kill all of these germs. They don't get rid of all germs, and that's why they aren't instead of washing your hands. They're using a hand sanitizer is beneficial when you can't get to a faucet to wash your hands. We have gel hand sanitizer around town halls and community centers, and police and fire vehicles, and all of our maintenance vehicles now have hand sanitizer in them. And you'll want to use it until the gel dissipates and your hands are dry, and that's when the hand sanitizer has worked properly. Workers are responsible for cleaning their own area, and this is part of personal hygiene. We can rely on custodial staff to clean bathrooms and frequently touched surfaces like doorknobs and light switches and conference tables, but you are responsible for cleaning and sanitizing your own spaces if you have your own vehicle, if you have your own desk, if you have your own phone. These things can be sanitized by either using a paper towel with a spray disinfectant that have been placed throughout town hall and other buildings, or using a pre-moistened disinfecting wipe. And every town building will either have or will have a supply of disinfecting wipes coming to them so that you'll be able to wipe your keyboards down and your telephones and your pens and pencils. And it's also important not to share those same objects. If you share a phone, if you're in an office that only has one phone and you have to share it, make sure there's wipes near it so you can sanitize between users. Staffing and operations is the third part of the training, and this talks about symptoms of COVID-19. And those symptoms include a cough, fever, chills, muscle pain, shortness of breath or difficulty breathing, sore throat, and a new symptom of loss of taste or smell. These are quite a wide variety of symptoms, and having one or maybe two may not prompt you to think you have COVID-19, but it is important to contact your healthcare provider if you do have any of these symptoms. There are certain underlying conditions that make people more susceptible to contracting and suffering from a severe case of the virus. People that are 65 years or older, people with chronic lung disease or moderate to severe asthma, heart conditions, immunocompromised individuals, severe obesity, people with diabetes, chronic kidney disease, and people with liver disease. We have seen trends in the health data that shows people with these underlying medical conditions tend to suffer from COVID-19 more than others without these underlying conditions. Employees are required to get tested for COVID-19 when they do display symptoms, and this is important to know because you need to contact your doctor right away to get the test ordered. And while you're symptomatic with symptoms of COVID-19, you cannot return to work until the test results show that you're negative. Employees are required to inform their supervisor if a member of their household is sick or if a member of their household has tested positive for COVID-19. The supervisors should contact the health department for more information on how to treat those individuals, those employees, whether they need to stay home themselves in quarantine or if they're safe to come to work. If you do test positive, you must stay home and isolate. Isolation is different than quarantine. Quarantine is a way for public health professionals to monitor the movements of people who may have the disease. But if you do have the disease, you need to isolate. And that means that you stay home and you stay away from other people. You can't visit public places while you're in isolation, but make sure to take care of yourself and rest and stay hydrated. Keep in touch with your doctor, and as much as possible, stay in a specific room away from other people and your pets. If possible, it's best if you can use a separate bathroom during this time. Isolation is generally 14 days, but there are other factors that come into play. While you're in isolation, you'll want to monitor your symptoms. Take your temperature, avoid sharing household items, and always clean and disinfect high-touch surfaces so you don't end up infecting other members of your household. When you are having trouble breathing or have persistent pain or you're having issues with staying awake, these are times to call 911. Emergency signs of COVID-19 is when you have bluish lips or a face, confusion, trouble breathing. Always stay in contact with your doctor and never hesitate to call 911 if you need help. Part of coronavirus tracing is called contact tracing. If you or someone in your close contacts has tested positive for coronavirus, you'll be contacted by a member of the Department of Public Health, or if you live in Harwich, you'll be contacted by the Visiting Nurses Association to do contact tracing. And this means that You will be interviewed and find out where you've been the last few days prior to your symptom onset and who your close contacts are, your household members, or if you share a small office space or a vehicle with others, those would be considered your close contacts if you've been within 6 feet of a person that is positive for 10 minutes or more. And those people that are your close contacts will also be required to quarantine rather than isolate. And they'll be in contact with the Department of Public Health or Visiting Nurse Association during that quarantine or isolation time to make sure your symptoms are resolving and be able to help you through that process. If you have been tested positive and you had symptoms, you will have to stay in isolation and not return to work until at least 3 days have passed since your recovery and at least 10 days have passed since your symptoms started. So that's where that 14 days comes from. If you have been laboratory confirmed with COVID-19 and had not had any symptoms, so if you were maybe a close contact who decided to get tested, or you felt you were in a large gathering and felt it was a good idea to get tested and you didn't have any symptoms, and if the case comes back where you are positive, you will need to stay home for at least 10 days since the test was administered. And the last part of the training is cleaning and disinfecting. The town is going to provide daily janitorial services for all buildings, and cleaning and disinfecting common spaces, frequently touched surfaces, door handles, handrails, restrooms, conference rooms, activity rooms. All of those areas will be taken care of by the janitorial services. If a employee tests positive, the town will take specific steps to disinfect areas in that case. We will determine which employees have been exposed, and we'll take additional precautions, which include closing off the area for 24 hours, opening outside doors and windows to increase air circulation, and cleaning and disinfecting the areas used by the sick person, including bathrooms, offices, common areas, etc. We will be using EPA-certified disinfectants that are effective against COVID-19, and our staff will wear gloves and a mask during this disinfection process. Contact information: if anyone has any questions about this training or COVID-19 in general, you can always contact me at the health department. I also have staff available if I'm not readily available, and you can call us at 430-7509 or find our email at health@town.harwich.ma.us. And more information is always available on the website, the town's website, and mass.gov website has a plethora of information on COVID-19, the current status, case updates, as well as frequently asked questions. So I want to thank you for listening, and you will have access to this training manual either in print or by a PDF to your email. And the town is doing what we can to keep you safe. And thank you for listening.